Student, good day. And now we start our lectures today. But before our lectures, I give you some information. Student, in this semesters, you have the practice of second course. Practice as called as a project activity. And on this practice, you must complete all the tasks for this practice. And now I explain. You must to find this practice on your portal, project activities. And we did post on this portal task for you. Task of this practice, it's very simple. In this portal, we can find the example of project of department of the hospital, and you must to create any project of hospital and post on your portal. All information you can find on the portal. Okay, student, and now we start our lectures today. The first topic of our lectures is bleeding. It's very important topic for general surgery. Bleeding. There is what is it? Bleeding and blood loss topic of our lectures. Вообще, у меня лекция сейчас. Попозже, да? Да, все хорошо. Student, bleeding. This condition can be found in various fields of medicine, but they are most often found in surgery. Why? Initially, a lot surgical disease, caused by trauma, caused by destruction of soft tissue, cause of destruction internal organs, and in surgery we very often found this condition. Now, what is it, bleeding? Bleeding, this outflow of blood from the blood vessels in violation of the integrity of their walls. Student, the first classification of the bleeding, depending on the cause of the bleeding, can be mechanical damage to the blood vessels wall. For example, stab wounds, fracture wounds. The second groups, necrotic damage of the vessels wall. For example, it's stomach ulcer. Inflammatory damage of the blood vessels wall when the patient have the purulent disease. Fourth group, coagulations disorders. It's very often caused by coagulation disorders as disease of hemophilia A, hemophilia B, and maybe C, hemophilia. And fifth groups, violation of vascular permeability, maybe with hemorrhage, fever, with renal syndrome, maybe other disease. For example, in this slide you can see the knife wound. Knife wound, as called household injury. It's very often caused by external bleeding. Next slide, you can see the fracture and bleeding from the open lip fracture when the fracture led to rupture of the vessels. Так, next. Next cause, internal bleeding, gastrointestinal bleeding in patient with the peptic ulcer disease. In the slide you can see a method of exam. This patient got gastroscopy, and then you can see the picture of the stomach, and you can see the ulcer of the stomach. What is it, ulcer of the stomach? It's necrotic damage of mucus and the submucous layers of the stomach. On next slide you can see the real bleeding, arterial bleeding in the stomach from the ulcer. And you can see the stream of the blood. And in here you can see the bleeding from the duodenal ulcer. The blood clot cover the ulcerate defects. Result of the bleeding is clearly visible here. Result is a large blood loss, and in this slide you can see the large blood loss. Large blood loss led to shock conditions. Student and Sareb, therapeutic practice. A significant role in the etiology of pulmonary bleeding is assigned to non-specific and purulent destructive disease. Now, for example, it's bronchitis, it's chronic pneumonia, it's bronchoectasis, next pneumosclerosis, and abscess and lung gangrene. Abscess and lung gangrene led to destruction of the lung and according the bleeding. Next mechanism, it's a violation of vascular permeability. For example, in this slide you can see the fever of Ebola. Fever of Ebola is still limited to parts of Africa. And in second pictures you can see the hemorrhagic rash appears over the entire body. Next cause, hemorrhagic vasculitis. And in this slide you can see the hemorrhagic rash on the leg. The cause is the signs of hemorrhagic vasculitis. Student, in this slide you can see the coagulation system, coagulation cascade, and I don't explain very detail this cascade, but now I tell you about this cascade have the intrinsic system and extrinsic system. Intrinsic system, as I call the contact activation, factors of the clotting, have the two mechanisms. Contact activation when the patient gets the injury, and tissue injury activation when the tissue injuries, some factors of clotting, activities the development of clot. And the next system fibrinolysis, system fibrinolysis have two cascade inhibition of fibrinolysis and stop of fibrinolysis. This is a coagulation cascade. Student, in this slide you can see the some explaining what mechanism of bleeding when the patient have the disease of hemophilia. Now, at the first pictures you can see the normal blood vessels, and when these blood vessels get the injuries in here, we have the bleeding starts. If your patient have the hemophilia inside the vessels, don't development of the clotting, and we have the currently bleeding. But it's normal. We have the completed fibrin clot in here, and this completed fibrin clot close the injury of vessels wall, and we have the stop bleeding. Next, very important syndromes of bleeding is coagulation disorders and disseminated intravascular coagulation, DIC. Student, now I tell you about the coagulation factor disorders. We have two groups of coagulation factor disorders. The first groups inherited bleeding disorders, and second groups acquired bleeding disorders. Inherited bleeding disorders such as hemophilia A and B, one Willebrand's disease, and other factors of deficiencies. Acquired bleeding disorders can be with the liver disease, can be vitamin K deficiency, and DSC, dissemination coagulation. Student, now I tell you about the anatomic classification of the bleeding, and in this slide you can see the other type of external bleeding. Now, in the first you can see the capillary bleeding. It's very often when the patient has the small injury, this patient has the capillary venous. If your patient has a large trauma, large injuries of the skin and subskin tissue, maybe venous bleeding, and next type it's arterial bleeding. And below you can see the features of this and difference between this type of the bleeding. Capillary bleeding features the slow, even flow, but bright red color. Venous bleeding have the steady, slow flow and dark red colors. The capillary have the bright red colors, venous have the dark red colors. And arterial bleeding have the spurting blood, pulsating flow, you can see in here, pulsating flow, and the bright red color. And in the slide you can see the anatomical classification. For external arterial bleeding, blood is bright red in color and has a strong pulsating steam. When venous bleeding, dark cherry blood flow, even steam, and while the capillary bleeding, blood allocated uniformly across the surface of the wounds. Student, next type of anatomical classification of the bleeding, it's parenchymal bleeding. Usually parenchymal bleeding from the liver and spleen. Now in this slide you can see on the first pictures you can see the liver rupture, and at the second slide you can see the lacerated spleen in here, lacerated spleen. And next slide I explain you. The shell of the spleen is very thin and delicate. So we cannot suture it. And this patient with laceration spleen need to splenectomy, surgery of splenectomy. And at the first pictures you can see the midline incision during the surgery. And next second pictures you can see the splenectomy, moment of the surgery, splenectomy. And on next slide you can see the surgery of the liver rupture. Final view of create rupture of the liver tissue. It's sutured with help that tamponate by the flap of creator amentum. And this you can see suture and tamponate of creator amentum. Student, in this slide you can see the different types of the seams. In here. Student, the bleeding have the many classification, and the following classification is based on the relationship of the leaking blood of the external environment. Bleeding into the environment is known as the external bleeding. Bleeding within the body's tissue, space, cavity, and hollow organs is known as the internal bleeding. And internal bleeding is divided into two groups. The first group's obvious bleeding, and the second group's hidden bleeding. And now I explain you. Bleeding may occur into the cavity within the body, either an open or closed cavity. This includes bleeding within the open cavity. It's nose and paranasal sinuses. It's mouth or throat. It's open cavity. Lung or airways. Gastrointestinal tracts. Urinary tracts. And uterus and vagina in woman. Student, it's a cavity called as an open cavity. Why? All this cavity, connected with environment. And next type of the cavity of the space inside the whole body, it's closed cavity and closed space. Now, for example, it's pleural space and pleural cavity. No, as you think, pleural space, pleural cavity are around the lung, and this bleeding called as a hemathorax. Bleeding inside the pleural cavity called as a hemathorax. Pericardial space around the heart, and bleeding inside this cavity called as a hemopericardium. Abdominal and peritoneal cavity, bleeding inside this cavity called as a hemoperitoneum. And next close cavity, joint space, and bleeding inside the joint space called as a hemarthrosis. And final space is cranial of the skull, intracranial space, and bleeding intracranial space called as a intracranial bleeding. On next slide, you can see the pictures of this open cavity and follow organs. And as you told you, at the first, the nose and paranasal sinuses, nose and now I mark you, nose and paranasal sinuses, and here paranasal sinuses. And this cavity connected with the environment. It's open cavity. Next pictures, second pictures, follow organs, gastrointestinal tracts, and this you can see the esophagus, stomach, and then intestine. The third pictures, you can see the mouth or throat. It's two. This mouth or throat connected with environment. On next pictures, you can see the lung, all airways. Through the bronch and trachea, these cavities are connected with environment. On next slide, you can see the uterus and vagina in woman, and this cavity too connected with environment. And final pictures, you can see the urinary tract. It's a urinary tract too connected with environment through the urethra. In this slide, you can see the gastrointestinal bleeding, and you can see the ulcer of the stomach and the results of the bleeding, the loss of the bleeding. And this bleeding can be flow out through the esophagus to environments. If bleeding is within an open cavity, then it will be passed out with salvia. If you eat mouth, vomit, it's upper gastrointestinal tracts, upper part of gastrointestinal tracts, feces from the lower gastrointestinal tracts, mucus from the nose, urine from the urinary tracts, all discharge from uterus and vagina. At other time, it can be overt, where there will be bleeding through the relevant orifice without the respective excretion. Discharge all expectorant. Student, in this slide, you can see the other symptoms of the bleeding, and in this slide you can see how called these symptoms. At the first, hematomesis. What is it, a hematomesis? Hematomesis, it's vomiting of blood, often with upper gastrointestinal bleeding. Next symptoms, melena. Melena. What is it, melena? It's a black tarry stool due to the presence of degraded blood thin with low gastrointestinal bleeding. It's, I repeat, the presence of degraded blood, seen with lower gastrointestinal bleeding. Hematochezia. What is it, hematochezia? It's bright red blood in stool with lower gastrointestinal bleeding, particular rectal bleeding. And next symptoms, hematuria. Hematuria, it's blood in the urine, due to urinary tract bleeding. And vaginal bleeding, blood in the vaginal discharge, all spontaneous due to bleeding in the fallopian tube, uterus, all vagina. Its symptoms, and in the slide you can see, I repeat, you can see how to call these symptoms. Hematomesis. You can see the pictures of hematomesis. And you can see the vomiting of the blood, often with upper gastrointestinal bleeding. And the first pictures you can see the vomiting of blood. Don't degrade the blood. And in here, in the second pictures, you can see vomiting of the coffee grounds. It's degrades the blood, and become to the of coffee grounds. Hematochezia. It's stool with the blood. Hematuria. In the slide you can see the normal urine and urine with the blood. Called as a hematuria. Bleeding with enclosed cavity and internal tissue is known as a hidden internal bleeding. And now I show you what is it, closed cavity. No, at the first I explained the closed cavity don't connect it with environment, and we have the some cavity, some space in this. No, at the first the pleural cavity, pleural space around the lung. Pleural cavity don't connect it with environment. Second cavity is abdominal and peritoneal cavity. It's the same, abdominal and peritoneal cavity. Two, this space don't connect with environment. In the third pictures you can see the joint space, and if your patient has the bleeding inside the joint space, as called hemarthrosis, and this joint space too don't connect with environment. Cranium of the skull and intracranial space. Intracranial space to the close, and it's this closed space. It's closed space. And next you can see the pericardial space. Pericardial space to don't connect with environment. And bleeding inside the pericardial space called as a hemopericardium. If the bleeding occurs within closed cavity, there may be no obvious signs of blood loss initially, but signs and symptoms indicated of bleeding and pressure on the corresponding structures need to be noted. if you I repeat this. If the bleeding occurs within closed cavity, there may be no obvious signs of the blood loss initially, but signs and symptoms indicate of the bleeding and pressure of the corresponding structure need to be noted. And this in this slide you can see the first exam, apparatus exam. It's X-ray of chest. In this X-ray, you can see the level left side level of the blood inside the pleural cavity. It's very often and very important signs of internal bleeding inside the pleural cavity. Hemopericardium. In this slide, you can see the healthy heart, and heart with bleeding inside the pericardium cavity, and tamponade. This condition called as a tamponade. Hemopericardium, tamponade. And you can see the size of the heart decrease. Student, in the slide you can see the X-ray of the heart, and you can see the increase the size of the pericardium, increase the size of pericardium in here and in here. Student, now we can see the pictures with the abdominal cavity, and at the slide you can see the at the first you can see the laceration of the liver as a cause which led to bleeding. You can see the bleeding, active bleeding in here, and this condition called as a hemoperitoneal. Student, internal bleeding can be not only cavity, but it's within in soft tissue. In the slide you can see the two fracture. At the first fracture of the femur and rupture of the blood vessels, and results of this rupture of blood vessels, bleeding inside the soft tissue of the femur. And really, that blood loss in this space can be about the 1.5 liters. And second pictures you can see the fracture of the pelvic, and two, if your patient has the fracture of the pelvic, bleeding inside the tissue can be blood loss can be about the 2 and 3 liters inside the soft tissue. And here you can see the slide. Bleeding with the tissue is known as a hematoma. Bleeding inside the soft tissue as a hematoma. And the slide you can see this hematoma. It's accumulating blood internal tissue. In this bleeding may cause visible signs if it occur with the submucous lining of orifice, genitalia, ACE, or if it occurs within the subcutaneous tissue. And thus you can see the hematoma from the orbital space. And this you can see the brush. It's too bleeding inside the soft tissue. Student, and next definition. Let's explain what is the volume of circulating blood. We have these terms: circulating blood, and in normal human have the circulating blood about the student, now I show you this slide, and in 70 kilogram patients, circulating blood volume is 5 liters. It's 5 liters, approximate 70 milliliters per kilograms, and 7% body weight. Plasma from this blood, consists of 5% body, and about the 3.5 thousand milliliters, 500 milliliters, in a patient with 70 kilograms weight. And now external bleeding is usually easy to diagnose. It is more difficult to diagnose internal, overt, and internal hidden bleeding. Student, in the slide you can see the signs and symptoms of the bleeding. It's signs which can see. The first signs: brushing, hematoma, ecchymosis, petechia, small hemorrhage, or purpura, slightly large hemorrhages. And now I remind you what in here you can see brushes. Its symptoms, its signs of bleeding, and these signs you can see. Next symptoms: paleness of the skin, as I call it, pallor, paleness of the skin. It's very often symptoms of the bleeding. Next symptoms is low blood pressure. Next symptoms: lightheadedness, and fatigue and weakness. Student, all patients who have the bleeding have these symptoms. Blood loss, depending on the severity, triggers various sympathetic reflex as the body tries to maintain cardiac output, the injury that all the tissue are sufficiently oxygenated. Up to 10% of the blood volume can be lost without causing any physiological changes. Even a loss of up to 20%, which is clinically significant, will be life-threatening with the intact sympathetic reflexes. And this slide you can see. Student, note in here. Loss of blood. 50% of blood volume, about the 70 50 milliliters, may produce little or no obvious symptoms. 20% about the 1 liters, dizzy and on standing postural hypotension. 30% about the 1.5 liters, mild tachycardia, tachypnoea, and anxiety. 35% about the 1 liters, 0.77 liters, tachycardia about the 110-120 beats per minute, a marked hypotension, shock, and loss of blood, more than 40%, about the 2 liters and more, is life-threatening. Student, in this slide you can see how is blood distributed in the human body, and you can see the adult in the normal blood relative to total body weight is 6.7, about the 70%. Newborns 50%. And below you can see the liver. Liver have 20% of all blood the body. In the skin, subcutaneous vascular plexus up to 10%. In the spleen, up to 1.5 to 2% of blood. Blood loss, I repeat, blood loss more than 20% of circulating blood volume is a heavy eat. And features above with clammy skin, dizziness, and confusion may be signs of shock. Methods of stop bleeding, student. It's very open methods of stop bleeding, and all methods of stop bleeding are divided two groups. At the first, divided through two groups: methods of temporary stopping of bleeding and methods of final stop of bleeding. Methods of temporary stopping of bleeding. We have the four methods. The imposition of a tourniquet. The imposition of a tourniquet. Below I show you. The second method, maximum flexing of the limb. The third method, finger pressure. And the overall clip, fourth method is the overall clip in the wounds. It's methods of temporary stopper of bleeding. Methods of final stop of bleeding, divided to conservative methods of final stop of the bleeding and surgical method of final stop of the bleeding. Let's come to next slide. And this you can see methods of the finger pressure of artery to the bony protrusions. And in this slide, in these pictures, you can see the methods finger pressure of subclavian arteria, method stop bleeding finger pressure of temporary arteria, method stop of the bleeding finger pressure of carotid artery, method stop bleeding finger pressure of the axillaris artery, method stop bleeding of the femur finger pressure femur artery. It's this finger pressure of artery to the bony protrusions. Next method, stop bleeding with a tourniquet. In the slide we can see the rubber tourniquet in here. These wounds with the bleeding and put on the tourniquet upper part of the femur. This method is called stopping bleeding with a tourniquet. Student, in the slide you can see the methods of maximum flexing of the limb. Maximum flexing of the limb. The first pictures stop bleeding of subclavian artery. Second pictures stop bleeding of artery of the hands, of the arm. These pictures stop bleeding bleeding from the artery of the femur. And this pictures stop bleeding of artery of the tibia. And in this clip you can see the surgical methods of stop bleeding, temporary stop bleeding, and you can see put on the clipper on soft tissue and maybe the vessels. Okay, student, and now I show you the nasal bleeding and method of stop bleeding nasal bleeding. Student, we have the two groups method of stop bleeding, nasal bleeding, and in this slide you can see the anterior nasal pack. Anterior nasal pack. What? we put of tamponade. Tamponade is nose cavity. Tamponade is nose cavity, and stop bleeding. This tamponade from the anterior sides. Anterior sides. And this you can see on phantom. It's practical skills, and we will perform this stop bleeding, anterior stop bleeding in here on phantom in practical class. Student, in this slide you can see the post-nasal packing. Post-nasal packing, and now I explain. We have the catheter and introduce this catheter nasal cavity and come out from the mouth, fixing tampon in here, and introduce these catheters from the mouth. Introduce the posterior side, and packing the nose cavity. Student, next method of stop the bleeding from the stomach. Can use the tube of the Blackmore. Blackmore tube used to control rupture esophageal varices. It's tube of the Blackmore, and when we introduce this tube, esophagus and stomach, we inflate this balloon. Inflate the balloon, and this balloon press on the wall of stomach wall and wall of the esophagus and stop bleeding. In this next slide, Blackmore tube. Так, okay. Student, wait 1 minute, and now we come to next. topic of our lectures. Так, окей. Next lectures is blood type. Student, no, before this moment we talk about the bleeding, and is a very important methods of treatment of the bleeding. It's a hemotransfusion, but very long time hemotransfusion have problem, and only the beginning of the 20th century we can use the blood for the hemotransfusion. But now I tell you about the history of the blood type and blood hemotransfusion. A blood type, also known as the blood groups, is a classification of blood based on the presence and absence of antibodies and inherited antigenic substance on the surface of red blood cells. In the slide you can see the modern packet with the blood, and now I tell you. Student, also the idea of rewinding someone injected blood into their veins goes back to insideness. The first sexual blood transfusion was not performed until the 17th century. The story that Pope Innocent VIII was transfusion of his deathbed in 1492 with the blood of 3 young boys is a myth. It required English physician William Harris discovered of how blood circulates continuously throughout the body, announcing in 1616 and published in 1628. Yes, to make blood transfusion a surgeon prospect. Prior the Harris discovery, a physician generally believed that the venous were separate from the arteries, and that venous blood originated in the liver, and while arterial blood flowed from the heart. The first fully documented sexual blood transfusion was performed by English physician Richard Lower in February 1665 between 2 dogs. The most probably use of these experiments may be connected to be that one animal may live with the blood of another, consequently that those animals that want blood all have corrupt blood may be supplied from other with sufficient quantity, and of such as is good, provided the transfusion be often repeated by reason of the quick expense that is made of the blood. Okay, and this led to another successful dog-to-dog transfusion in 1666 at the Royal Society in London. On 26 September 1880, yes, at Guy's Hospital in London, Blundell attempt the first documented human-to-human blood transfusion. The recipient was a man named Brazier, between the 30 and 40 years old who was suffering from a tumor in his stomach and had lost considerable amount of the blood. The donors were drawn from among the 3 physicians, 5 surgeons, and other gentlemen in attendance. On once and half of blood was taken by a syringe and immediately injecting into the varus vein. The procedure was repeated 10 times during the course 30-40 minutes. At the first, the patient showed signs of improvement, but then he declined. Brother died on the 3rd day after the transfusion. Blundell subsequently transfused 5 other patients, all of whom died. The indication for transfusion include postpartum hemorrhage, extreme malnutrition, puerperal fever, rupture uterus, and hydrophobia. Since each patient has critically ill, it is impossible to know whether the transfusion contribute to their death. And finally, on 7 December 1828, Blundell completes the first unquestionable successful blood transfusion at Walworth, south of London. The patients are delicate woman, age 25, and the mother of 2 children was suffering from the postpartum hemorrhage after delivering her 3rd child. On the physician present, Mr. Davies was the donor. About 8 ounces of blood was injected over the 3 hours periods, and afterwards the woman said she felt as if life was being infused into her whole body. It's the successful results. And then, in the 19th century, analysis found that 243 cases in which transfusion was performed for acute or chronic anemia prior to 1873, and 143 about 46% results in complete recovery, 34 results in temporary benefits but failed to save life, and 19 fifths cause had non-beneficial results. The operation was almost invariable resort to in desperate cases. In the vast majority of failures, this could not be ascribed directly or indirectly to the operation, but was due to the other cases. In one certain of the cases, the operation was performed on account of hemorrhage during or immediately after the childbirth. Of this, 67 cases ended the complete recovery. It's good. 7 showed only temporary improvement, and while 30 terminated in death without any signs of previous improvement. It's results of 19th century chemotransfusion. And now I changed the situation at the beginning of the 20th century, at the beginning of 20th century, and as you know, in 2000, yes, Australian immunologist Karl Landsteiner discovered the AB0 blood groups. Blood groups. He also found that transfusion between persons with the different blood groups resulted in the destruction of red blood cells in the reception. Based on Landsteiner findings, American hematologist Ruben Ottenberg performed the first successful AB matching human-to-human transfusion at Mount Sinai Hospital in New York. In 1913, Richard Lewison, German-American surgeon at Mount Sinai Hospital, used sodium citrate to prevent donated blood from the clotting. It's very important discovery. This refrigerated enable blood to be collected and stored rather than having to be donated at the time of the transfusion. 1937, Landsteiner and Alexander Wiener discovered the rhesus factors, another blood group system which future increase the ability to match compatibility donors with recipients, and those reduce adverse reaction. Futures advance, including the identification of more blood group system, improvement in blood storage, the separation of the plasma into therapeutic components, infection disease testing, and improved screening of the blood donors. Continued throughout the 20th centuries and into the 21 centuries, making transfusion therapy safe, effective, and widely available. In the slide, student, you can see the Karl Landsteiner. Karl Landsteiner discovered blood groups. It's the beginning of 20th century. At the first, we can see the blood group system. AB0 blood group system, the classification of human blood based on the inherited properties of red blood cells, erythrocytes, as determined by presence or absence of the antigens A and antigens B, which are carried on the surface of the red cells. Person may those have type A, type B, type 0, and all type AB. The A, B, and 0 blood groups were first identified by Austrian immunologist Karl Landsteiner in 1901. Yes. Student, in this slide you can see the AB0 blood group system, and now we can see the patients with A groups, group A, have the antigens A on the walls of the erythrocytes, and in plasma antibodies in plasma, anti-B antibodies, anti-B. The patient with group B have the antigens on the membrane erythrocytes B antigens B, and in plasma this patient have the antibodies anti-A antibodies. Patient with group AB have the on membranes of erythrocytes A and B antigens, and in plasma antibodies absence anti-B, absence anti-A antibodies. And group 0, patient with group 0 have not any antigens on erythrocytes membranes, and this patient have in plasma have the two type of antibodies, anti-A and anti-B antibodies. Student, RH blood group system. The RH blood group system, human blood group, human blood group system. It contains proteins of the surface of red blood cells. It is the second most important blood group systems after the AB0 blood group systems. The RH blood group systems consists of 49 defined blood group antigen, among which the 5 antigen D, C, C small, A and A small are the most important. There is no D small antigens. RHD status of an individual is normally described with the positive or negative suffix after the AB0 type. The term RH factors, RH positive, RH negative, refer to the RH antigen only. Antibodies to RH antigens can be involved in hemolytic transfusion reaction, and antibodies to the RH D and RH antigens confer significant risk of hematolytic disease of future and newborn. Student, in the slide you can see the hemolytic disease of fetus and newborn. In the slide I can explain. This mother of this child have the RH negative factors, and when the child have the RH positive factors, the mother organism start the products antibodies anti the RH factors of the child. And when mother have the moment of birth child, this child gets the hemolytic disease. Student, and next problem of these RH factors, different RH factors, an acute hemolytic transfusion reaction. An acute hemolytic transfusion reaction, also called immediate hemolytic transfusion reaction, is a life-threatening reaction to receiving a blood transfusion. This reaction occurs within the 24 hours of the transfusion and can be triggered by a few milliliters of the blood. The reaction is triggered by preformed host antibodies destroying donor's red blood cells. This reaction typically occurs when there is a AB zero blood groups incompatibility, and is most severe when type A donor blood is given to type 0 recipients. Next blood group system, it's Kell factor. Kell factors, the Kell factor system is a blood group system that include 25 antigens, including the most immunogenic after A, B, and D, the K antigen. Based on the presence of K antigens in red blood cells or its absence, all people can be divided into two groups, Kell negative and Kell positive. The presence of the K antigens is not pathology and is inherited, like other human groups antigens. In Russia, it occurs in 7–10% of residents. Так, student, now we finish lectures today, and on next lectures we continue. We describe it how to define the blood groups.